So we train middle skill healthcare workers, and after 6 years and $9 million, I realized it doesn't make a damn bit of difference, because if you stick a person who's well-trained and cares into a broken system where they have to step over people's bodies, you actually make things worse for them. So instead of just kind of improving the snack bar kitchen communication on the Titanic, we decided, what can we do to impact this system at scale? The acute care system's such a dumpster fire that when you enter it, there's pockets of excellence. But what do you do for childhood poverty in Louisiana and West Virginia, which is the same as Somalia or Ethiopia? Those parents aren't addressing their own needs. When the car light goes off and the car says that the oil needs to be changed, they don't change it because they're not getting by. And a smartphone alert that says, oh, you should go visit your healthcare provider, isn't dealing with the core access issues. So we put together good minds and said, well, what would it take to really transform access to health, not sick care, at scale? And what it takes is 10 million well-trained, empathetic community healthcare workers that can visit individual Americans. So if you want an army like that, who do you call? General George Casey, who was the chairman of the Joint Chiefs of Staff and ran the most complex organization in the world. And so we've put together with General Casey a plan for how you would deploy and manage over 10 years, train, deploy, and manage the 10 million people who could do the things you really need, like provide frontline behavioral triage, mental health care, changing simple things like changing air filters, providing access to medication, because ultimately what people need is another human being that cares. It's great to have an app, but they need a person. And in this country, we are dying of broken hearts because there isn't a connection between people. So our challenge has been, how do you really change this system at scale and not just profit from patching a broken system? That's what we're endeavoring to do with the American Red Cross as our delivery partner, to do the actual training and run the field staff, and we'd love to talk to you more about it.